Okay, and so you have a pretty intense history of the Lyme, and remind me all of the things, because some of the things I'm not as well versed in. And tell me where your blood work was when you got tested a year ago.
Okay. All right. I have Lyme and 3 co-infections that we know about. I've got bartonella, which is cat scratch disease, and then Borrelia burgdorferi, or what they commonly call Lyme. That's with the spirochetes. They're little corkscrew guys.
In the blood.
In the blood. Yep. And then there's babesia, which is compared to malaria. It's a red blood cell disease. And I've also have inverted cortisol levels. Your cortisol goes up and down, and it's supposed to be normally up in the morning to help you get out of bed, and then it goes down at night to help you go to sleep. Mine was inverted. So it was low in the morning, causing intense migraines and obviously not being able to get out of bed and being productive. And then it was high at night. So it hit 10, 11 o'clock, and I'm ready to party. And so that was very difficult to be able to work and establish any kind of routine. So I've had that, and I've also have heavy metals poisoning. I'm off the chart on lead and mercury. And so last August, I had finished 19 months of chelation, and I went in to have my blood work done.
And you also have lipedema and Derkums.
Yes, I have lymphedema, lipedema, and Derkums, which is how I found Dr. Robbie. Was interesting story in itself, meant to be. And so the doctors, it took a long time for the Lyme to be diagnosed. It normally does with Lyme. Most doctors don't diagnose it. You have to find a doctor that studies it and that believes in it in order to get diagnosed.
And remind me where you grew up. You're from where it came from.
Yes, I grew up in a little teeny town called Gales Ferry, Connecticut, which is outside of London, the submarine base there. And that was about 10 minutes from East Lyme, Connecticut. And that's where Lyme first originated, and that's how it got its name. It got its name from Lyme, Connecticut. And there's also, I was across the Sound from Plum Island, where they did a lot of experiments on insects, bioweapons type thing. And I swam in that ocean, and I swam in that Sound, and I went crabbing in the Sound. And Connecticut is very humid, and I had a marsh in my backyard that had nothing but mosquitoes and ticks. And the ticks would come out as soon as it got warm, and
you would get 12 bites a day.
And it was just something that we did. And I covered in mosquito bites. Mosquitoes, not just ticks carry Lyme, but also the mosquitoes do. And I probably don't know why, but, you know, anyway, that's just the way it happened. We'd have these ticks pulled off us every single day for 3 or 4 months. So I was sick very early on. But then I ended up moving from Connecticut to Virginia, and about 1 or 2 years later is when the group of mothers in Connecticut all got together, and all their kids were diagnosed with juvenile rheumatoid arthritis. And they went to the doctor as a group, and then they were all diagnosed with JRA, and then they found out, they started doing more research, and that's when they found out that they were bit by ticks and what the deer ticks carried, and it came up with Lyme.
So from the beginning.
From the beginning.
That's crazy.
I went 55 years without being diagnosed. When I moved to Virginia, I was bit again by a tick and got Rocky Mountain spotted fever, and that is fatal. And I don't know why, but on top of everything else, I got RSFAC again. So I got that one and somehow managed to pull through with that. But I was undiagnosed for 55 years. And every Lyme doctor that I've seen doesn't know how I'm still alive. And they can't even give me any guesses, or they really don't know how to treat me, because people can't survive with that much infection in their body, especially with the high levels of mercury and with lead. But I'd done the chelation, and the chelation was supposed to get the heavy metals out of my body. I got 75% of them out, and that would also weaken the biofilms that the spirochetes use to go into the cyst in the biofilm stage. The spirochetes use. They build up little walls. And so the theory was the reason why I wasn't getting cured from the Lyme and the co-infections was because of the heavy metals.
So the heavy metals were in the way of the Lyme and the other things
they
being
use them
cured.
as a build. Yeah, this.
Like, oh, look at all this junk. We're going to hide behind it like a wall.
Exactly.
And so clear the wall, and then you can clear the Lyme and the co-infections.
Yes, but I was not in remission. My blood work was terrible.
A year ago.
It was a year ago. I get my yearly blood works done every August. And so I get dark field microscope is really the only way you can tell what your blood is doing. And so we were looking at my live blood cells under the dark field, and we could see massive amounts of cysts and biofilms, which weren't there the year before. So all that had been done was it had driven them into the cyst and the biofilm stage, so the Lyme couldn't get killed. So there was no remission. And so,
Yeah. And so the different components that you were looking at this year, because you just got your blood work done, and there was a lot of really amazing changes since incorporating the lymph massage.
Yes.
Tell me some of those components that changed.
Well, my red blood cells, they're supposed to be round under the dark field microscope, and they're supposed to be moving freely and not being stuck together. Last August in 2023, they were congealed, all my red blood cells, and they were misshapen. And they were sick, and there were lots of ghost cells and just all different kinds of things. And you could see the bartonella, and you could see a couple of little spirochetes that hadn't gone into the biofilm stage. And it was terrible. I mean, and then they do a dried blood cell also, and that shows a lot of skeletal things and lymph in particular. And it showed because you can check your blood under this microscope and you can see how your lymph is doing. And my lymph is doing terrible.
Last year.
Last year at this time. Yep. And this year, my red blood cells were perfectly round. They were moving. They were screaming fast. They were just sliding so fast. And they were, like I said, they were perfectly round. They were perfectly spaced. And there were no spirochetes. And there were no bartonella, which I've had, like I said, for 58 years.
58 years, and everything you've tried in the past didn't get rid of it. It just drove it deeper.
Yes, it just drove it deeper.
And now it's gone.
Yeah, because part of the infections were, it totally plugged up my lymphatic system. And I also have a few cute little genetic components that make it very difficult for me to detox. So I wasn't detoxing at all. And my lymphatic system was shut down. The infections, the theory is, of course, you really can't know because it's really hard to get a clear picture of our lymphatics. But the lymphatics have little valves in them. And what happened, I was so filled with infections, was the valves were stuck open. So my lymph would just flow back and forth and back and forth. So whenever I would exercise, I would swell.
Lymph reflux is what they call that.
Okay, thank you. Yeah, the little hinges, the little doors would not close. I never created any negative pressure, ever. So anytime I'd have any kind of a movement or anything, I had another lymph doctor about 10 years ago, and they used a machine, and they would drain me, and then by the time I got home, I was filled back up again because the infections in my body just would not keep those little valves. But with the work that I've been doing with Dr. Ravi, we've been able to process a lot of the toxins out and a lot of the infections out and get my lymph system where it's actually moving, and the little hinges are starting to work, and I'm starting to be able to build up negative pressure.
It's incredible.
It's incredible. It's a miracle.
Yeah, your doctor actually said your lymph is doing amazing.
My lymph is doing, they could tell that from the dried blood cell.
That is so awesome.
My lymph is doing amazing.
I'm so excited for you.
And obviously I've lost a lot of the infection that I had before because my red blood cells are just rock stars right now. Looking really good.
That is so awesome. I
Thank
can't
you.
wait to see what happens.
I know. I'm excited too. Thank you.